Some of you, probably many of you don't know me. My name's Glenn Tinkoff. I was one of the many in here that started this mess, and it has become one of the finest state trauma systems in the nation. With that said, good morning, and welcome to this special celebration to reflect on our shared tremendous accomplishment in establishing the trauma system of care for 30 years. This is 30 years ago. And first, I'd like to acknowledge several dignitaries in our audience. Katie Leibel Marin, Behavioral Health Consortium Administrator, who is attending on behalf of Lieutenant Governor Kyle Evans Gay. Katie, is she here? Yeah. Okay. And Department of Health and Social Services Secretary Christine Link Young. Thank you for attending. Division of Public Health Director, good friend, and sometimes enemy, Steve Blessing. The legislators and our foundational contributors. How the trauma, this is how really to show you how we have not only maintained the trauma system, but improved it. Should I go? And I have to thank Elle and Paul Westlake. Elle, where is she? She prepared me. Thank you. So do I go on? Oh, fantastic. It says 9:03. I'm a minute late. Here to speak on the trauma as a public health issue is Mr. Steve Blessing, the Director of Division of Public Health within the department, the Delaware Department of Health and Social Services. Director Blessing has served the Division of Public Health for over 30 years in various capacities, including EMS Director, I remember that, and Paramedic Administrator. I remember those times well. And 12 years of Chief of Emergency Medical Services and Preparedness Section, keeping Delawareans safe. Through his management of the State Health Operations Center and Hurricane Sandy and Irene, among other emergencies, Director Blessing has led the DPH efforts to develop and expand response capacity for the division and the department. Welcome, Director Blessing.
Good morning, everyone. Thank you, Dr. Tinkoff. It's wonderful to see so many trauma system advocates gathered in one place. Trauma system of care is a communal commitment to developing and maintaining a systemic approach that analyzes the entire spectrum of trauma care, from prevention and 911 calls through pre-hospital care, hospital care, and ultimately rehabilitation and then public education. The agencies involved work together to make each other better. Many gathered in this room today have been instrumental in developing, refining, and maintaining a landmark and truly revolutionary program that has saved countless lives. Generations are alive today through the work of our statewide trauma system. I want to speak briefly about the relationship between public health and trauma care. The two are closely related, but 30 years ago, that was not really the case. Things were not readily recognized. As a new executive assistant in 1995, some of you may remember Secretary Nazario and Dr. Konigsberg. They were the secretary and the director of public health at the time. They were big supporters of the program and getting it off the ground. And they thought it would be good for me as a new person to work with the Trauma Systems Planning Group and assist in the development. They said it would be a piece of cake. They didn't tell me about Dr. Tinkoff, but actually it was really hard work, and the vision that went into that was so far ahead of its time that it was hard, I think, for a lot of people, even on the public health side, to understand where we were headed or where you were headed. I certainly did not know at that time. Those times were great, and over time we have kept this in the Office of EMS and the Office of Preparedness, and those two offices have been seen at times, especially in those days, as sort of appendages in public health. They weren't sure where their fit was. And that's not unique to Delaware, because in a lot of places those offices might be seen in public safety or with the fire service or in other places. The old adage is that public health is most often visible during a time of crisis, whether it's a pandemic, natural disaster, or disease outbreak. The true measure of success for public health, however, is found in what never happens: the illnesses that are prevented, the lives that are extended, and the suffering that's reduced before it begins. Prevention is the underpinning of our trauma system, and that's what makes the trauma system a true public health program. And over time, we kind of figured that out. Once our system took hold and started to generate data, it was astounding. Public health dwells in a world of data, and our data validated what the system was doing, which was quite remarkable, and there's some stats that I think may be presented on that in a little bit. And it produced the truth necessary to persuade policy on key issues, especially those, for us, surrounding motor vehicle operation. Our data enabled us to share with others our great success as well, and many here assisted in other states and other jurisdictions replicating what we did here. I know Dr. Tinkoff, Linda Jones, Mary Sue Jones, Diane Hainsworth, others have all been involved in helping other jurisdictions, and that made Delaware, among other things, made Delaware a true leader in trauma system development. No single agency or organization can face the challenges placed on our society by traumatic injury. It takes a collaborative system approach. What we learned from our trauma system of care has informed us on the development of several other systems of care. The system of care approach is a tool to reduce incidents of injury, disease, and death, ultimately improving the overall health of our citizens. Now, before I finish, I want to say that for DPH, over these 30 years of, from the conception of the system and maintaining it, the one person who was there at the very beginning and shepherded this to maturity was Mary Sue Jones, and I just wanted to recognize her and thank her for her service and commitment. And thank you, Mary Sue. Because of the work along the way contributed by those from numerous agencies and partners, including the continuing work housed in our Office of EMS, now with Diane and Brittany and Paul, we're able to see that it has meaning. The work has meaning, and it's truly made a difference to the citizens we serve. It's a gift for us to be able to look back on these 30 years and say that. So thank you all very much. So now I'd like to call Diane Hainsworth up to the podium, the Chief of EMS and Preparedness. And Diane's been my deputy or right-hand person for pretty much my entire career, and nothing could have ever been done without Diane's hard work and dedication. Diane.
I should say thank you, Director Blessing, but I'm going to say thank you, Steve, because we know each other so well. As Steve said, Delaware engaged in a collective action to which is unprecedented. Healthcare professionals came together to create something bigger than a single hospital or a single agency. Following the first meeting in 1992, it took 4 years to enact the legislation to create the Delaware Trauma System of Care. At this time, we're going to honor some of the founding contributors who came together to bridge gaps and create partnerships that changed the face of trauma care, not only in Delaware, but in the United States. Honorees, please stand as I call your name, and then join me up front so that we can get a group photo of these founding contributors. If you can all hold your applause to the end and do it all at one time, I'd appreciate it. Dr. Edward Alexander, Brian Bartley, Marilyn Bartley, Steve Blessing, Deb Eberly, retired Senator Bruce Ennis, Mary Sue Jones, Linda Laskowski Jones, Dr. James Marvel Jr. Unfortunately, Dr. Ross McGargle couldn't be here today. Dr. Stephen Murphy, Dr. Glenn Tinkoff, also Dr. Robert O'Connor, who couldn't be here today. David Clark, Dr. Tom Sweeney, Jeffrey Evans, and Larry Tan. So if we could show our appreciation to this hardworking team with a very generous round of applause. And I'm going to step out of the way and come over here. Oops, I was in the middle. Oh.
I'll be out of the way shortly.
Yeah, that's great.
And again, a big round of applause for these folks. You guys want to make your way back to your seats? They took some already, and then we're going to take some more outside.
Excuse me.
Now, while they're moving their way back to their seats, I also want to recognize some other folks in the audience. Many of us have served the trauma system in various roles throughout the course of its tenure. I can remember very vividly my first experience in regards to the introduction to trauma care and the trauma system. It was in the early 90s, and it was at a Newcastle County EMS paramedic research. And Dr. Glenn Tinkoff and Linda Laskowski Jones came in and gave us a presentation in regards to the trauma system and trauma care. And I will tell you, for those that don't know, a paramedic group can be a tough audience, just so you know. And they were the only thing standing between us and the end of the day. So I think we might have given them a little bit of a hard time, just a little bit. But again, there's lots of ways that people contribute to and have been part of the trauma system. So if you have served the trauma system in any capacity, be it administrative or clinical, for 20 years or more, please stand. Please stay standing. If you have served the trauma system for 10 years or more, please stand. And I genuinely want to thank each and every one of you for everything you have done to make the trauma system what it is today. So thank you all. It is now my pleasure to introduce Delaware Department of Health and Social Services Secretary Kristen Link-Young, a nationally recognized health policy leader with more than 15 years' experience in federal and state government. Secretary Young has served as the Deputy Director of the White House Domestic Policy and Deputy Assistant to the President for Health and Veterans from 2001 to 2025. She held senior roles at the Obama White House and the U.S. Centers for Medicare and Medicaid Services and the U.S. Department of Health and Social Services. She has also served as Deputy Secretary of the North Carolina Department of Health and Human Services. Please welcome Secretary Young.
I'm
a little shorter. Thank you so much, Diane. And it's great to be here with all of you today. 30 years ago, a group of dedicated professionals shared a vision. Every person injured in Delaware deserves the same high standard of care and the same fighting chance at survival. Today, we celebrate what that vision has become, the Delaware Trauma System of care. To the pioneers who were just recognized, your dedication didn't just build a program, it built something that has saved lives every single day for more than 3 decades. On behalf of the Department of Health and Social Services, and most importantly, the citizens of Delaware, thank you so much. You didn't just stop at enabling legislation or creating a framework. You developed protocols and standards ensuring that every trauma patient in the state receives the same quality of care. The commitment to equity at all levels in emergency care is not a small thing. It is, in many ways, the whole thing of what you have created and what has developed and sustained an enduring system here in Delaware. Delaware has long taken pride in being first to ratify the Constitution, first, as my daughter was excited to learn, the first to create the spacesuits that NASA has used. And the story that we are telling today is another one of those first. We are among a handful of states with truly inclusive statewide trauma systems where every acute care hospital participates and every provider follows the same standards as we drive innovation in pre-hospital and hospital settings and throughout the care continuum. No injured person falls through the cracks based on geography or social drivers of health or other standards. This system creates a culture of collaboration over competition, and our trauma centers lean on one another and learn from one another. You share data, refine protocols together, measure yourselves against the best outcomes possible and not against each other. That spirit is what makes the system work. Mortality rates for seriously injured patients have fallen dramatically over the life of this system. But for Delawareans between the ages of 1 and 44, traumatic injury remains the leading cause of death and disability. And the work of this system has never been more important than as we gather here today. Before I close, I want to take a moment to recognize a giant of this work. Steve Blessing announced his retirement from DPH yesterday, and as you all know, he is a true pioneer in Delaware's emergency services work. He is an insightful expert who has driven change as a leader, and he is a friend and mentor to so many of the people here. Delaware is lucky to have had Steve for the last 30 years, and we will miss him greatly. So today, while looking back and recognizing where it started, we also look forward. The state of Delaware will continue to support and invest in this system, in public health infrastructure, in emergency medical services, hospitals and trauma care, and the people who make it all work. 30 years in, this vision is still very much alive, and so is the commitment to the system's success. So thank you so much for all that you have done and all that you will have continued to do, and I'm excited to welcome Dr. Tinkoff back to the podium for the exciting next portion of our agenda. Thank you so much.
Thank you so much. You didn't call me, Steve. I'd like to thank Secretary Young. Those statements of fact. Delaware Trauma System is a recognized model of trauma system care in the United States and can be emulated, and I did so in Northeast Ohio just recently, the same model, and it works. We will continue our reflection on our shared purpose to provide optimal care to trauma patients anywhere in our state. On August 2025, Sussex County EMS was the first agency on the scene of a bicycle accident, which left Chris Evans with traumatic injuries. John Wright, Deputy Director of Public Safety, EMS for the Safety and EMS for the Sussex County Department of Public Safety, along with Chris, are here today to share his harrowing experience that thankfully had good outcome. Please welcome Chris and John.
Good morning. In August of this past year, the Lewis Fire Company, Georgetown Ambulance Squad, and the Sussex County EMS responded to a bicycle crash that left a patient critically injured and facing life-threatening blood loss. The rapid administration of pre-hospital whole blood proved to be a decisive, life-saving intervention. This early transfusion helped to stabilize his condition long enough for advanced care, demonstrating the critical value of getting blood to patients before they even reach the hospital. His survival is a testament to the coordinated efforts of emergency responders and the strength of the Delaware State Trauma System of care, including partners in the blood bank at Delmarva for ensuring that we have a ready supply of life-saving blood products, BB Hospital for their immediate care, and Christiana Hospital for the advanced treatment that ultimately supported his recovery. That survivor is here with us today. Please allow me to introduce Mr. Chris Evans.
I have my tissues ready because this typically gets a little emotional for me, so pardon me if I have to take a brief break. But I've been asked to give you a patient's view of Delaware's trauma system of care. And I'd like to tell you what the title of my paper is. You all don't see it and you won't know it, but it's Delaware Trauma System, Wonderful Alignment. Because to me, that's what I saw. Wonderful alignment. So I was asked to give you a patient's view of Delaware's trauma system of care. Firstly, I have to stress an important point. This is my rendition of the story. And this account is based on the events obviously that occurred August 9th, but this was based on conversations had with first responders and many people that were involved in my care that day and soon thereafter. I largely have no recollection of that fateful day and no recollection of the months thereafter. So again, this is based on accounts from many of these professionals. And as I said, these professionals we now consider friends. My wife and I owe this group a tremendous debt of gratitude, and we now consider them friends because we visited many of them in the past few months to hear these stories, and we were able to hear this commentary firsthand. And that's very important, as these professionals do what they do every day. And that fateful day in August, I experienced an amazing synchrony of events and tasks that occurred as if the planets aligned perfectly. And for me, they did with my life. As some of you may know, that day, I left from Rehoboth on a bike ride of 30 or 40 miles, which I used to do 200 times a year. Unfortunately, I was catastrophically struck by a car early in my journey, in my voyage. And that was just the beginning of my experience with Delaware shock trauma. When the EMTs arrived in under 5 minutes, I barely had a pulse. Luckily, this rig had whole blood on it, as previously stated, and within minutes after the accident, they were about to give me the first transfusion, life-saving transfusion, I might add. And that was the first miracle of the day, not the last. Soon thereafter, I arrived at BB Hospital in Lewis, where I was initially given a less than 1% chance of living. But doctors and nurses jumped into action, patching my wounds and further assessing my health. Yet it was soon decided that I would have a much better chance of survival at a level 1 trauma center. So that meant they had to stabilize me, and they got me on a helicopter in record time. And I made the quick flight to Christiana Hospital in Newark, arriving alive within the hour. That was the second miracle of the day. Upon arrival, clinicians continued to bandage my wounds and tried desperately to find all the relevant sources of bleeding, as I was still losing a ton of blood, having been transfused several times prior to that. Although, when I got to Christiana, my condition was upgraded to 1 to 2% chance of living. Doctors informed my wife and grown children who are now there on site in Newark that they should probably make arrangements for my body. Yet I'm here. So I beat those odds, and that was the third miracle of the day. With my innards now partially deconstructed and lying adjacent to me on the working table, doctors were able to find the source of my bleeding and put that to an end once and for all. With that in the rearview mirror, they then began reconstructing the extremities on my right side, as well as my pelvis, which is broken in half and now has 2 large titanium bolts holding it together diagonally. All the metal that was installed in my body and the fact that it was done with my goal of walking again normally, that was the 4th miracle of the day. So with no interest to fast forward through the other feats of commitment and kindness received that day, I then began the arduous journey of convalescing, rehabilitating, and taking stake in my physical new normal. In the rehab hospital, I was being taught to walk again, taught to swallow, to eat, and at first even taught to breathe. The doctors and physical therapists were unbelievable, and every day I saw some progress. But I quickly decided that the best medicine and therapy for me was to be home with my family and to try to be home by Thanksgiving. So I asked the therapist to really step on the gas with my therapy, and we were putting multiple hours a day in, going through all those processes. And as a testament to Delaware's trauma system of care and the phenomenal care I got subsequently in rehab, my wife was able to take me home 5 days before Thanksgiving. That was after 15 weeks in hospitals. 8 weeks of that was in intensive care, taken care of by Delaware's best. That was the 5th miracle. And it was truly great medicine being home, because after just 25 more weeks since my Thanksgiving return, I can now finally drive again, walk unaided, and I came here today fully mobilized. And while I cannot confirm whether or not these were true miracles through divine intervention, what I can tell you is that I definitely received miraculous care from Delaware's system of trauma, a system that we should continue to adequately fund, we should continue to adequately resource, so that these professionals can do what they do every day, which is save lives like mine. What's that worth? Thank you.
Always difficult to follow. That's why we do it. Thank you, John. Thank you, Chris, for sharing that story, and it's very special. Okay, we're going to move on. Here to give us an overview of the Delaware Trauma System of Care's highlights, impact, and data is Linda Laskowski-Jones, who is no stranger to this subject, as I know. And Dr. Rosenbaum, you're here? There you are. Robert Rosenbaum, who will give, evidently you've become a data geek, I heard. Yeah, okay. Well, also, well, you probably were always, but I never.
I have nice things to say about you too.
We'll also provide some details to demonstrate the impact of EMS, whole blood, having on trauma care in Delaware. That's important to recognize. Delaware is likely the only state, there may be one other, and I haven't fleshed it out, that has a whole state whole blood program. Of course, that's something to do with size and an incredible EMS system. But this is not the future. This is now, and the resistance to whole blood in the field has to go away. That's my own comment. So I'll have Linda come on up. Good job.
I'm also vertically impaired here, so I'll move the microphone. Good morning, everyone, and thank you for the opportunity to celebrate the 30th anniversary of the Delaware Trauma System and the progress we have made from 1998, actually it was 1992 when it all began, to present. As a founding member, I have had the privilege of watching the system grow from an idea into a statewide commitment that has saved lives. Chris, your story was incredibly powerful, and thank you for sharing it, because it is why we do what we do. Today, we celebrate not only a system, but the people behind it, EMS professionals, nurses, physicians, surgeons, rehabilitation teams, hospital leaders, public health partners, dispatchers, first responders, and community advocates. Your dedication has made this possible. I remember when this work began, when leaders from across Delaware came together as the Trauma System Planning Group. Our goal was to build a more organized and coordinated approach to injury care. With enabling legislation and the formal launch of the system in 1998, that vision became a reality. Since then, Delaware has built an inclusive statewide trauma system, and one of our proudest achievements is that every acute care hospital in Delaware participates under shared standards and expectations. So injury care in our state is guided by a common promise of quality. Over the years, we have shown that high standards and accountability matter. Through trauma center designation, regular review, and strong performance improvement, Delaware built a culture of continuous learning, and the results show impact. In a 10-year analysis of trauma registry data from 1998 to 2007, in a paper that was published by the Journal of Trauma by many people in this room, so Drs. Tinkoff, Mary Sue Jones, Dr. Ed Alexander, who else is here? Dr. Murphy, Steve Murphy, and I think there was one other individual in that group, but they did the analysis of the first decade to look at impact. And what they found, after looking at more than 40,000 trauma cases in that first 10 years that came to Delaware trauma centers, mortality fell across the state from 4% to 2.7%. But the most dramatic thing was that in the most critically injured patients, mortality fell from 45.7% to 20.5%. And that's what a trauma system does. It gets the most critically injured patients to the right place at the right time. These data do not just represent numbers. They represent families kept whole and lives given another chance, like we heard about this morning. Since that first decade, we have sustained and improved upon these outcomes, and the positive momentum continues today. We have a longstanding commitment to using data to guide action. Delaware's trauma registry is supported by all acute care hospitals in the state, and it is informed by pre-hospital EMS reports, which are so important. That has given us a true statewide picture of injury and helped us to direct prevention in the areas where it can do the most good. The data tell us how far we have come and where we must go to target our efforts. The number of Delaware residents seriously injured enough to require hospitalization has actually declined a little since 2019, but at the same time, our injury mechanism has shifted. Whereas we began with motor vehicle crashes, which are certainly still an issue, our primary mechanism of injury today is falls. More than 65% of falls involve people over the age of 65, and about 1 in 4 of those leads to a head injury. So we know through those facts that prevention is essential, and we need to target our efforts in those areas. Our injury data have helped shape research, policy, and focused action on falls, motor vehicle trauma, brain and spinal cord injury, pediatric injury, and violence. And they have also reinforced something we learned early in taking care of patients. Recovery does not end at discharge. The continuum of trauma care includes rehabilitation, long-term recovery, and quality of life. As we celebrate this milestone, I feel both pride and gratitude, pride in how far we've come, and gratitude for the people who built, sustained, and strengthened the system over 3 decades. The Delaware Trauma System shows what is possible when public health leadership, clinical excellence, and true collaboration come together in the service of others. It has been one of the greatest honors of my professional life to be part of it. So as we look ahead, may we continue to strengthen injury prevention, sharpen our response, support recovery, and ensure that every person injured in Delaware receives the best care possible. And now it is my pleasure to turn the podium over to Dr. Rosenbaum.
Thank you and good morning. What a privilege. I get to speak with you during EMS week. And we haven't mentioned that, but I do want to acknowledge that this is EMS week, and it's an important time for us to remember all the work done by our pre-hospital providers who are such an integral part of the system. People speak about standing on the shoulders of giants. It's rare that you get to stand in a room and speak to some of those giants. The honored guests who are listed are many of my mentors, medical directors like Bob O'Connor, Ross McGargle, who aren't here, Tom Sweeney, and Glenn Tinkoff, who, when I wrote this, I started writing Dr. Tinkoff, because even 30 years later, I still have a hard time calling you Glenn. And I'm not sure I want to say what I learned from you, but Diane might be able to tell you one of the things, which is tenacity. And I appreciate that because I always enjoyed seeing how tenacious you were. And the development of this trauma system is one of the things where I think you were at your most tenacious. So, as I said, I have something nice to say about you. We did do the right thing. That is 100% correct. And we continue to do the right thing. The development of the trauma system and the doctors who helped build this has saved so many lives in Delaware. They didn't just build it to save lives, they built it instilling the belief that we would continue to improve and do better. And that's part of our culture. And that's part of why I'm up here to talk to you about what we do with performance improvement, my data geek piece of things. That commitment is something that we continue to hold as we move forward. We recognize that systems that are satisfied with what they've achieved stagnate and regress. And if you're not trying to move forward, you will move backward. You've heard about a paper that Dr. Tinkoff and so many others authored in 2010 after looking at 10 years of data and a staggering 45.7% death rate of our most critically injured patients. And that was cut in half within 10 years of the development of the trauma system. We maintained that. We did well to maintain that. It was an achievement for 15 years. But we were looking to improve. What could we do that would make a difference? That major leap really showed itself in 2023 with the addition of paramedic units carrying whole blood for transfusion during pre-hospital care. And it's important to note that this idea was not born out of some legislative or administrative or other act of brilliance. This started at the grassroots level. These were paramedics who came with an idea that some other systems in the country had started and said, can we do this here? We worked within the hospital system, the Office of EMS, the Division of Public Health, our Board of Medical Licensure and Discipline, our hospitals, our blood bank of Delmarva, to build a partnership to make this work. We are the first state, another first, the first state where every pre-hospital responding unit can transfuse a patient in the field. And that capability saves lives. Estimates are that only 3% of EMS agencies provide pre-hospital transfusion services. Delaware can proudly list 4 of the 300 agencies in the country that do this. We've treated over 550 patients with pre-hospital transfusion. And the addition of blood, I will say, has been one of the most impactful clinical things that I have seen in pre-hospital care in 30 years of working in emergency medicine. What it's also done is give us the opportunity to see a decrease in Delaware's high morbidity, high impact trauma mortality for the first time in 20 years. I noted that decrease in death rate, or that maintenance of decrease in death rate from 45% to the 23% range, and we hovered at that level for years. We finally broke through after mid-2023, and in the 2024-2025, we've seen death rates for our high morbidity trauma patients, our ISS greater than 24 patients, for the doctors in the audience. We hit 19.5% and 17.5% for those death rates. That meaningful decrease is not only statistically significant, but it's clinically significant. That's dozens of patients who have survived. You've heard about one of them. His story is remarkable. Mr. Evans was a pre-hospital trauma circulatory collapse. We all know the survival opportunities for that patient are extremely limited. But with the addition of whole blood, we now have many more stories like Mr. Evans of unexpected survivors. Patients who 20 years ago we never would have expected would be up here speaking to us, telling us their story. Thank you. We will continue to move forward with our progress. We've made achievements, but we're not going to be content with them. That's what performance improvement is about. We'll look for other advancements, other ways to deliver more complex, more meaningful care at the scene of an incident, whether that is with advancing our paramedic procedures, adding pre-hospital physician responses, finding ways to get more blood to more patients. We are building out these processes so we can continue to see the gains that we've made and make even more progress for Delawareans and Delaware visitors in the future. So it's a great day to be with you. It's a great day to celebrate our trauma system, and it's a great day to celebrate the achievements of what we've done to help patients survive. With that, I will hand this off to Sean Elwell. Sean is the chair of the Delaware Trauma System of Care. Thanks.
Good morning. Before I go too far, I know we recognized Paul and Elle earlier, but this is quite a tribute, and it wouldn't be possible without all the hard work. So a huge round of applause for Paul Westlake and Elle Hammond for putting together today. So thank you. I believe I have the hardest job of the morning, not just because I stand between you and the door, but because it is my job to articulate what the next 30 years looks like. 30 years ago, Delaware made a bold choice. We chose not to leave trauma care to chance. We chose not to accept that geography, circumstance, or timing should determine whether someone lives or dies after a serious injury. We chose to build a system. Today, as we celebrate the 30th anniversary of the Delaware Trauma System, we're not simply honoring a milestone. We are honoring a vision, one that has grown stronger with every challenge, every partnership, every life touched, and every person who has given their time, skill, and commitment to make this system what it is today. The vision of the Delaware Trauma System has always been larger than any one agency, any one hospital, or any one profession. It is a shared vision rooted in collaboration. Trauma care begins with prevention and continues with 911 dispatchers, first responders, EMS clinicians, law enforcement, fire service, transport teams, emergency departments, surgeons, nurses, rehab specialists, social workers, and so many others that I did not mention. It continues through recovery, reintegration, and support for patients and families. No single organization can do this alone. And that has always been one of Delaware's greatest strengths, our willingness to work together. We have built something special because our relationships are strong. We know one another. We trust one another. We can pick up the phone and solve problems, move quickly, and stay focused on what matters most, delivering the best possible care to patients when time matters. That strength has allowed us to accomplish things that others often struggle to do. Delaware has shown that when people are aligned around a mission, extraordinary things are possible. We have been able to innovate, coordinate, standardize, and improve in ways that others admire and seek to replicate. And that is something that we should all be proud of. The Delaware Trauma System works because every voice matters. Rural and urban providers, large institutions and smaller partners, new professionals and seasoned leaders. Clinical experts and operational teams, public agencies, private organizations, everyone has a role, and every contribution strengthens the whole of our system. The best systems are built when people are invited in, listened to, and empowered to contribute. At the same time, we must remain open to innovation. The healthcare environment is changing rapidly. New technologies, new treatment models, new workforce realities, patient needs, and risks demand that we continue to keep evolving. We cannot rely only on what worked yesterday. We must be willing to test new ideas, embrace the evidence that we find, use our data wisely, and adapt with purpose. We must always seek to improve our care and never settle. Never settle for good enough. Never settle for outdated processes, and never settle when there's another life to save, another outcome to improve, or another lesson to learn. That commitment to continuous improvement is what keeps a great system great. If we want this system to serve the next 30 years, we must also focus on sustainability. Strong systems require people, funding, infrastructure, training, readiness, and long-term commitment. They require succession planning and investment in the next generation of leaders. They require resilience in times of stress and clarity in times of change. Sustainability does not happen automatically. It is built intentionally. That is why our advocacy matters. We must continue to champion the value of trauma systems to our policymakers, our community leaders, and to the public. We must continue to tell the stories of lives that have been saved, the disabilities that we've prevented, the readiness maintained, and our communities that have been strengthened. Trauma systems are not a luxury. They are essential public health infrastructure, and the value of the Delaware Trauma System extends far beyond our borders. What has been built here benefits the entire region. We serve travelers, neighboring communities, and patients whose lives intersect with Delaware in moments they never expected. We contribute expertise, leadership, and partnership across state lines and demonstrate that a coordinated trauma system can elevate care for everyone. We should also recognize a simple truth. These systems don't run themselves. Behind every protocol, training exercise, committee meeting, quality review, transfer decision, outreach effort, and other patient outcomes are people that are doing hard work, often unseen and often unrecognized. There are organizations that support all aspects of the system that are doing so because they understand that excellence requires effort. It takes time, discipline, resources, and mostly it takes commitment. And for that, I say thank you to each and every one of you here today. It's easy to celebrate a mature, high-functioning system and forget how much work it takes to sustain it. It's easy to assume it will always be there. But systems remain strong only when people continue to invest in them, challenge them, protect them, and improve them. So today, as we honor 30 years, let us renew our responsibility. Let us continue to collaborate. Let us strengthen our relationships. Let us remain inclusive. Let us stay open to innovation. Let us improve care and never settle. Let us advocate boldly. Let us build sustainability for the future. And let us never take for granted what generations of dedicated professionals have created together. The vision of the Delaware Trauma System is not only about what was built over the last 30 years, it's about how we continue to make it stronger. Thank you very much. Dr. Tinkoff is going to say a few words to conclude, but before he does, I just want to remind everyone at the end, don't run out. We're going to take a group picture in front of the apparatus that is on the opposite side, right? Someone will show us how to get there. So Dr. Tinkoff.
Thank you. Sean, a very important and powerful statement. Sustaining this is what's important, but continuous improvement, as Linda's talked about, is also important. So let's continue for another 30 years. This concludes our event. I thank you for celebrating a dynamic system of care that has withstood the sands of time and is well positioned to meet its future challenges with our continued guidance. As Sean just said, we will meet outside for pictures and let's commiserate. We haven't seen each other. I haven't seen y'all for quite some time. So I'd love to greet you all. And why didn't you tell me? You'll never stay a retiree, Steve. So thank you. We conclude.